Good afternoon, everyone. Welcome to today's update on COVID-19 in Alberta. With us, as always, is Dr. Deena Hinshaw, Chief Medical Officer of Health for the province. Dr. Hinshaw will provide a brief update, and then we'll open the floor to questions.
Thank you, Tom, and good afternoon, everyone. Before we begin today, I'd like to outline how we will be sharing updates over the holidays. I know that many people follow our daily numbers and care deeply about this information. I also know that our surveillance teams have worked incredibly hard since this pandemic began. That's why for the next week and a half, we will be modifying our COVID-19 reporting while still keeping Albertans informed. From the 24th through the 27th, we will not be posting detailed updates online. However, except for December 25th, we will provide a high-level summary of preliminary data every day through my Twitter account. This will provide early estimates on the number of new cases identified the previous day, the number of tests conducted, as well as hospitalizations, ICU admissions, and positivity rate. On December 28th, I will provide another live update, and we will post our usual data online, providing a detailed breakdown of the previous 4 days. On December 29th and 30th, we will continue updating our website each day, followed by a break from December 31st to January 3rd. During this time, there will again be no website updates, but we will provide preliminary data each day through my Twitter account. I want to note that this only impacts our reporting schedule. Our remarkable healthcare teams, including those working in the lab, those who do contact tracing, those who manage outbreaks, and those who care for patients who are ill, will continue working every day to support Albertans. Turning to today's update. Over the last 24 hours, we have identified 1,301 new cases of COVID-19 in Alberta and completed more than 19,000 tests. This means our positivity rate currently stands at about 6.8%. Hospitalizations continue to rise. There are currently 821 people in hospital, including 146 who have been admitted to the ICU. Sadly, 19 new deaths were reported to us in the last 24 hours. My deepest sympathies go to the loved ones of these individuals and to anyone who is grieving a loss. This time of year can be especially painful for those mourning the loss of a loved one, and my thoughts are with you. Preventing these deaths, as well as preventing hospitalization and ICU admissions, is what makes vaccines so important. As many Albertans already know, Health Canada approved the Moderna vaccine today, making this the second COVID-19 vaccine authorized for use in Canada. Exact amounts and timing for Alberta are still being determined. The incoming arrival of a second vaccine is good, but it also does not change the seriousness of our current situation. We are now well into the holiday season for many, and I want to stress yet again how important it is that we limit our in-person interactions whenever possible. Thanksgiving get-togethers helped fuel a spike in cases that we are still fighting to reduce today. We cannot afford for that to happen now, when our baseline of new daily cases is 4 to 5 times higher now than it was then. As another example of the impact that social interactions can have, I want to tell you about a trend we have been watching with our school-aged case numbers. As you know, Alberta saw a slow increase in cases among school-aged children throughout the fall, showing a steeper rise in the month of November. In late November, new health measures were implemented. These included a pause on team sports and group performance activities, as well as limitations on social gatherings. Although junior and senior high students shifted to learning at home at that time, and elementary age students remained in school in person, the new case rates for all 3 groups plateaued and then started to drop in a very similar way. In all 3 age groups, the daily new case numbers roughly tripled from the beginning of November to the end of the month. Cases started to plateau at the beginning of December and have fallen over the past few weeks. The similar trend in all 3 age groups supports the other evidence we have seen suggesting that the school model in place is protective against in-school transmission. Instead, it seems that it is mainly all the other in-person activities that children undertake that are exposing them to the virus and helping to spread COVID-19. This tells us once again that reducing social interactions is critical to protecting each other and bending the curve. Please limit your social gatherings whenever possible in the next few days and stick to your household. While we have provided an exemption to allow those who live alone to attend a single gathering during the next few days, please only undertake this if absolutely necessary. Absolutely do not go if you are feeling even slightly ill. This is a happy time of year, but also a challenging time for our province. We are seeing encouraging signs, and the spread of COVID-19 is starting to decline. However, cases are still extremely high, and our hospitalizations continue to rise, which is impacting our ability to care for all Albertans. Our choices during the upcoming statutory holiday season can help build on our downward momentum, or they can send our case numbers rising again. Over the last 10 months, we have been through so much together, and we have each made personal sacrifices for the collective good. These changes have not been easy, but they have made a difference. Someone asked me recently what I was wishing for during the holiday season. This year, I wish that all Albertans embrace the restrictions in place and make the safe choice over the next few days. This is hard, I know, but these sacrifices help protect all of us. Following the rules is an act of generosity to our community and to our province. I also wish that despite the restrictions in place, every Albertan still finds ways to connect safely with those who mean the most to them. What if, during the time we would normally be with those we love, we took the time to write a letter or record a video to those people in our lives that we are missing seeing this year? What if we used that time to tell them the things we are grateful for that they bring to our lives? Showing gratitude in this way not only shows caring for the person you are writing to or speaking to, there is actually good evidence that gratitude is also good for the mental health of the person feeling grateful. This means both people benefit from this action. This year, I wish that every healthcare worker understands how deeply we appreciate their sacrifice and determination. 2020 has been challenging for all of us, but it has been particularly hard on people caring for those who are ill and most vulnerable. I want to thank all those who are doing this important work. I also wish that everyone who has been impacted by the health measures in place, the business operators, restaurant owners, staff, performance groups, and so many others, is applauded for the resiliency and determination they have shown over this past year. Finally, I wish for all of us the strength, patience, and determination to remain vigilant in the fight against COVID-19 over the coming months and to look out for one another. Unfortunately, simply wishing won't make it so. It is up to each of us to do our part. This has been a challenging year, and I recognize the holidays will be tough for many. Let's all treat each other with extra understanding and compassion. If we support each other and continue doing what needs to be done, we will get through this together. Thank you, and I'm happy to take questions.
All right, we'll go to the phone now. Operator, could you put through the first caller?
Thank you. Yes, the first question is from Kevin Nimick, CTV.
Hi, Dr. Hinshaw. You spoke about the safety of the school model. What can parents expect from the second half of the school year? Will older kids continue to learn from home?
We are looking closely at all of the lessons that we've learned over the past many months, and we're planning on a return to in-school at this point in time, but I'll repeat what I said in the fall and throughout the points in time when we did see community transmission starting to rise, which is that each one of us has a role to play in making school re-entry safe, because we know and we can see from this data that we have been tracking over the past month that in community transmission levels are the biggest factor about the success of return to school. So I want to encourage everyone to do your part. Let's bring our numbers down. And again, at this point, the in-person return is the plan.
Operator, could you put through the next question, please?
Tanya Slover, Rocky Mountain Outlook.
Hi, Dr. Hinshaw. Today we learned that there is a coach for the Alberta Junior Hockey League that's being fined and suspended for speaking to the media about having COVID and an outbreak that affected his team. As the Chief Medical Officer of Health for Alberta, what's your reaction to this information? Do you think Albertans should be punished for having COVID and speaking up about it?
I haven't seen the specific information, the interview, or, I don't have any knowledge of that particular situation. I think it's critical that people are able to share their experiences, and I also think it's critical that they share information that's factual and validated. So again, I can't speak with any specifics to this particular instance, but I believe both things are important. First of all, people, of course, should not be shamed for having COVID. We know that everyone is at risk. No one is spared. And so we need to be supportive of those who have COVID-19. And it's also critical that, especially those who are in positions of authority, make sure that when they are sharing information, it is accurate. Again, I have no idea what the specifics were in this situation, but both of those things are critical.
Operator, could you put through the next question, please?
Dean Bennett, Canadian Press.
Hi, Dr. Hinshaw. Can you confirm, have you given the green light to the Oilers and Flames to begin the season at home?
We've been in discussions with the Oilers and Flames with respect to their training and have provided the exemptions necessary for them to be able to do their training work. We are continuing to be in discussions with respect to the return to play, and that's something, again, that's not just Alberta, that's a discussion that's happening across the country.
Operator, could you put through the next question, please?
Tomasio Da Silva, Global TV Calgary.
Hi, Dr. Hinshaw. I'm actually inquiring about the continuing outbreak in the ER at the PLC, the Peter Lougheed Centre in Calgary. How concerning is it that the staff numbers that have been infected have now gone up to 18? And is there enough PPE, or is the PPE working to protect them?
I don't have the specifics of each individual outbreak. What I do know is that whenever there is an outbreak in an Alberta Health Services facility, the Workplace Health and Safety and Infection Prevention Control teams work closely with public health to make sure that prevention is in place. I know that each case of COVID-19 in a healthcare worker has an individual assessment to determine what factors led to that particular infection. And I know that when I've been talking to Alberta Health Services, the majority of those cases in healthcare workers were determined to not have been a workplace exposure. Again, I don't know the specifics of this particular outbreak, so I can't comment on it. But I do know that my colleagues at Alberta Health Services take every single outbreak very seriously, and that PPE is a critical part of outbreak prevention, and training on how to do that appropriately is something that is a part of everyday life when working in healthcare, not just when there's an outbreak, but actually all the time to prevent outbreaks. And of course, it's something that remains in place and is emphasized when there is an outbreak like this one. So any specific details about this particular outbreak, Alberta Health Services would be in a better position to provide.
Operator, could you put through the next question, please?
Sean Frenette, CTV.
Hello, Dr. Hinshaw. Yesterday, massage therapists were given the exemption to do some work, but now athletic therapists are telling us that they also are pressing for the ability to do some work. They say many of their patients are calling them in desperation and pain, and they point out that in Manitoba, Ontario, and BC, athletic therapists are currently allowed to work. So why weren't athletic therapists also granted an exemption to do some work at this time?
When we were looking at options, first of all, when we made our initial decision about the kinds of services that would be permitted to continue and the kinds of services that would need to stop, we made the distinction based on which practitioners were part of a regulated college, regulated healthcare professionals. And so I can't speak to the circumstances in other provinces, and I'm not sure in other provinces whether or not those individuals would be part of a regulated college. Again, in Alberta, that was the distinction that we drew because our main goal right now is reducing the number of close contacts that people have in their everyday life. And drawing that line was our way of indicating, obviously, we do want to continue to have access to healthcare for people, but also want to reduce those close contacts. With respect to massage therapy, we heard many examples of the instances where people's health was being impacted, and so created this particular exemption with respect to this particular health professional. And I know that there are other people who work in fields where the work that they do does offer benefit to their patients. At this point in time, we are doing this one specific exemption for massage therapy based on the fact that we saw the significance of that particular therapy across the province. Of course, there are others. We also know that we're looking at all of the restrictions that are currently in place early in the new year once we have an assessment of our numbers over the holidays, and we may be in a position to make other decisions at that time based on how our numbers go and based on, again, this need to be continually reducing our close contacts.
Operator, could you put through the next question, please?
Rafi Bujikanian, CBC.
Hi, Dr. Hinshaw. We're hearing from paramedics associations that they've worked very hard to get their members recognized as healthcare workers, given that they are first responders. They believe that, they're in uncontrolled environments. They really should be prioritized to get these COVID-19 vaccines. And I'm wondering, especially given Manitoba today at least announced that paramedics will be among the second line of workers to get vaccinated in the new year, why is Alberta not also prioritizing paramedics, or at least has already determined when they'll get their vaccinations?
There are many healthcare workers and many other Albertans who would benefit from COVID-19 vaccine. Many of those healthcare workers who are not in these first particular groups that are eligible, all of them, in fact, provide valuable services, and paramedics are one of those groups. It's really critical to emphasize that decisions on eligibility for the very first, very limited supplies of COVID-19 vaccines were in no way made based on the value that people bring to the system and to their work. And all of those healthcare workers who were not in the first phase continue to provide exceptional value. And we are looking at that second phase of the groups that would be eligible to receive vaccine once we are able to offer it to all those who live in long-term care, designated supportive living, those who work with them, and those who work in the areas that are hardest hit by COVID-19. And of course, there's a long list of those groups that we are looking carefully at. I anticipate that decisions around those groups in phase 2 will be made at some point early in the new year, but at this point in time, again, paramedics are a critical group. They provide a very valuable service, as do many others, and we are looking at many, many options, again, with that ethical framework, looking at risk, looking at the highest risk of severe outcomes to be able to allocate our scarce supply of vaccine in the best way possible.
All right, we've got time for 3 more questions. Operator, could you put through the next one, please?
Dylan Short, Edmonton Journal.
Hey, Dr. Hinshaw. I was just wondering, with the Moderna vaccine being approved today, what specifically has the government done proactively to prepare for the arrival of the Moderna vaccine? And will the rollout differ from the Pfizer vaccine in any way?
We have been preparing for many months, knowing that it was anticipated that the first 2 vaccines that would be approved in Canada, based on how far along they were in their application processes, we had anticipated that the Pfizer and Moderna vaccines would be the first to approve. So we have been preparing for many months to make sure that we have the appropriate infrastructure in place, the right temperature freezers for Pfizer, the right temperature for Moderna. And so that infrastructure is in place and planning is underway to determine the doses, and we're working with the federal government to determine the dose numbers and where they will go. One of the advantages that the Moderna vaccine has is that it can be moved from the site to which it's delivered to another site to be able to offer immunization. So we are looking at the option of being able to move the vaccination program into long-term care and designated supportive living for residents, and that is something, again, that is a part of the planning for the Moderna vaccine. The details, again, are being continually worked out because it does depend on that final volume that we get from the federal government allocation, and so more details will be available in the coming weeks as we learn those final details.
Operator, could you put through the second last question, please?
Thank you. Bill Kaufman, Postmedia.
Yes, hi, Dr. Hinshaw. Given that we saw such a dramatic spike immediately following Thanksgiving and all the Thanksgiving gatherings, and people were urged at that time not gather, do you realistically expect a fairly significant surge from Christmas holiday season in infection?
It will, as I often say, depend on all of us and the choices that we make. While we encouraged people to consider virtual gatherings at Thanksgiving, we did not create an order at that time, and we actually put together guidance for gatherings to make them a little bit less risky. And so I think the difference between Thanksgiving and the next week, looking at the different holidays that are taking place over the next week, is that we currently have a legal order that does restrict the ability to have social gatherings. And we also have a significant number of cases, and we have a significant number of people in hospital with COVID-19. So our situation has changed, and I am appealing to all Albertans, because of this change in our situation, that we need to collectively make the choices that will not accelerate our spread, and we need to be considering other ways to connect with family and friends this holiday season.
Operator, could you put through our final question, please?
Thank you. Yes, the final question is from Tom Vernon, Global News.
Hi, Dr. Hinshaw. Thanks for taking my question. This is back to the Moderna vaccine. The delivery timeline is a little awkward, I suppose. It could be Christmas Day or this weekend. How quickly do you think we can get these doses out into these facilities? Do you anticipate we'll be giving up these doses before the end of the year, sometime next week?
We don't yet have, again, those finalized details about the exact dates when they will arrive. It's extremely unlikely that they will be arriving in the next day or two. Again, it does take some time to plan all of that out. So we will, again, continue to work with the federal government, and when we have that specific timeline and those specific numbers, we will be able to communicate more broadly what those plans are. But again, given that as of today, we're not able to determine those final details, I would anticipate they're not going to be arriving today or tomorrow or over the weekend.
Thank you all for joining us. Dr. Hinshaw will provide another update on Monday afternoon. Have a safe holidays.